All right. Good morning, everyone. It is lovely to see you all. Thank you for joining us for the last webinar in our series with Disability Rights Wisconsin. My name is Angie Railing. My pronouns are they, them, and I am a prevention coordinator with WCASA here. I will turn it right over to Pam so we can get started. If there's any questions, please don't hesitate to put them in the chat. You can also unmute yourself and ask if that feels better. You can send me a private message and I can ask on your behalf if that also feels better for you. Just don't hesitate to ask any questions you might have. All right. Thank you for being
Great.
here, Pam.
Thank you. Thank you for inviting DRW to present on such an important topic. Um, so most of you should know me because hopefully you've been attending the whole series, all 4 times. This is the last one. If you haven't, as Angie said, there are recordings of the first 3. So if you've missed any, please feel free to go back and look at them. And then I just want to um, tell you that at the very end, when there's time, I will talk again about our program and how to connect with us and refer questions or clients or issues over to us and see how we can collaborate together. I think that's the benefit of working so closely with WCASA and domestic abuse is really we're all advocates trying to do the best we can with the limited resources we know we all have. So we're always better together, and the more we can collaborate and not have to reinvent the wheel, the better it is. So thank you for coming. This week, the the training is a little different. We kind of highlighted it by saying that if you attend all of the other 3, that when you come to this one, you would qualify to get a free copy of the curriculum to be sent to you, which my office thanks you because I have boxes all over that I'd like to get rid of. But mostly because I'd like to get it in the hands of advocates who do great work and have been asking for a long time for good free resources to work with individuals with intellectual and developmental disabilities around healthy and safe relationships. So without further ado, I am going to share my screen. All right. Everybody can see that okay, I'm assuming. So I wanted to start out by saying that this curriculum is through a grant that we have through the Office of Violence Against Women, the Underserved Grant. So if you use any of
Pam, I
these
don't want to,
materials,
I'm sorry to
oh,
interrupt you, but we're
yeah.
seeing the notes part.
Oh, you are.
Yeah.
Sorry. Let me
No, you're
stop sharing
fine.
then.
You're fine.
No, I didn't see, you'd think I've been using this long enough that I would get the right thing, but let's try it this way instead then. Better?
That's a little, yes. Yep.
Okay, good. All right. Thank you. So yes, this was paid for by the grant for Office of Violence Against Women, underserved grant, and it is definitely something that we made that we want people to use, but we also want to make sure that if you do use any of the handouts or any of the information that's specifically in the curriculum, that you make sure that you give credit to the grant and use the grant tag that's on the bottom of this slide, and it should be in every handout that we have as well, but I just want to bring that to your attention because that's necessary. So we're going to walk through the grant a little bit about the curriculum, how we got here, why we picked what we picked, show you some examples of some of the handouts, and then we're going to share an interview that I think is really a good perspective on why this is such an important topic. All right, so an introduction to the curriculum. So why do we need a curriculum? So for those of you who have met me before or been part of this, you know that I've been doing this work. Well, I've been working with people with disabilities the majority of my life, but I've been doing the work at the intersection of victimization and people with disabilities for about 30 years. And in that 30 years, I came to figure out that the statistics that we've talked about prior in other sessions um, were really high. And I found out that the people that I was working with intellectual and developmental disabilities really got little or no education or information around healthy relationships. I mean, I think we can all agree that we don't do a good job in our public schools about educating people without disabilities. But if you add the disability, sometimes they're even taken out or it's watered down, or some parents remove them altogether from it, thinking that because they have a disability, that they won't understand or they won't ever be sexual. And that's just not true. And in my experience, when we do that, we them up to be victimized or more vulnerable. And that really um, is not okay. So over the years, I did a lot of research and looking for curriculums that worked for me as an advocate. And what I found is there were curriculums that were very intensive, that you needed hours and hours and hours of access to the individuals, or that didn't really speak to what it was that I needed for the individuals that I was working with. I had schools asking me to come in. I had done one-on-one sessions. I had had group homes or other residential facilities asking me to come in, and it just didn't fit what I needed. So I started doing a lot of the work just kind of on my own, on my experience of what I thought people needed. And when I started at Disability Rights Wisconsin, we had ended a grant within a couple of years of me starting here, and we had seen an opportunity to apply for this grant. And my supervisor at the time, Nadja Rosen, she said, "All right, so what's your dream list and what are we going to do?" And I said, "Mom, my dream list is to get some information to people with intellectual and developmental disabilities about healthy relationships so that the numbers can go down, so that there's adequate education and information." And then talking about that, we said, when I did work for a while with WCASA as the developmental disabilities coordinator, one of the things that I was told very often is that, excuse me, advocates would say, "Well, I don't know about disabilities, so we don't have somebody in our agency that does that, so we can't do that prevention or we can't work with those victims." And not out of them saying we can't, but we just don't know the right way, or we feel inadequate, or we want more information. So when we were putting this grant together, we talked about this isn't for any educator, although once it's released, other people can get access to it. But it's really written from the perspective of an advocate, teaching this and learning how to do it in a way that is helpful to them to be comfortable, and then can, pull in the audience that needs this information the most. So that's kind of the perspective that we came from. So then when we did receive the grant, we had to look at what are we going to do and how did we decide what to include. So I got the privilege of working with a woman named Shirley Paisley. She is from um, She's from Illinois, and she is in her mid to late 70s. And funny enough, is when I started this work 30 some years ago, I cold called her and asked her what she did and how she learned to do it and what could I do like that. And I wanted to be her when I grew up. And now we've become very good friends. But she helped me in kind of pulling this whole thing together as one of the consultants on the curriculum. So it was really valuable for me to learn from her, but also um, we got to talk to each other about what we wanted to put in here and what we thought was important using our perspective from both of us. So we decided that it needed to be a curriculum that could be used at face value, that was useful both in sessions, but also that we could pull out information. So if somebody says to you, "I need you to come into my school and do a boundaries activity," you can pull that out if you need to without doing the entire curriculum. Best practice is to use the whole curriculum, but we also know that time is limited. We don't have access to a lot of people. So we want to make sure it's usable in whatever format that works best for you. And then the other part was is that we pulled probably, I think, 15 different curriculums from around the country, a couple from even international, and looked at what they had versus what we wanted to see what we are missing or what more we could add to it. So it was a very extensive first year of looking into that. And one of the things that all of you know happened, but in retrospect, we didn't know was going to happen, was that COVID happened. So our intent was to go around and have in-person listening sessions to talk to people with disabilities to see what they wanted, to talk to advocates to see what they wanted, to talk to parents or educators or disability professionals to see what they wanted. So we had to kind of rewrite and go with a lot of online virtual, which now is normal to us, but at the time was very much not normal. And figuring out the best way to do that. But we pulled in a lot of information and we pulled together what we thought was a pretty extensive amount of information. I probably could write three curriculums with what we pulled together, but we settled on the curriculum that you'll see today. So, one of the things that I've been very adamant on in this curriculum is that the verbiage, nothing about us without us, which I think I've talked about in the other sessions, which means that if we're going to be talking about educating people with disabilities and giving them resources and interacting with them, then we also need to include people with disabilities as part of the team that's going to teach this curriculum. So the intent of the curriculum is to be taught in a co-teacher format. The one teacher would be the advocate that works at the local agency, and then the co-teacher would be a self-advocate, which is somebody with a disability who has experience standing up for themselves and empowerment and will help be the voice of people with disabilities in the class. And if I stand up there as a white, able-bodied woman to say this is what you have access to do and what you should do in a healthy relationship, there's a disconnect because that is not my life that I live. So having somebody with a disability brings validity to it, and it brings that ability for somebody to say, well, they're like me, and therefore this pertains to me. So that was very important for us to include. And we hit a few bumps along the way figuring that out. What we think will likely happen once the agencies start to use this curriculum is they may have to do the first round of teaching without a self-advocate and then become familiar with someone from the class that wants to co-teach with them, or they may have to reach out to disability organizations and find out who might be a self-advocate that would be valuable to add to the team. What I did was I did two pilots. One was in Brown County and one was in um, oh shoot, Menominee, Wisconsin. I forget the county, Menominee County it might be. Um, and so the one in Brown County, I put out feelers and asked for self-advocates to apply. And once they applied, I did some interviews. One of the assessments that I did, and I think this is important for all self-advocates to consider, is to make sure that the individual was in a healthy place from their abuse. The likelihood of them experiencing abuse at some point in their life is pretty high. So making sure that we're not re-traumatizing anybody in the process. So found a young man who was very eager to do it. He actually was a client of mine, a survivor from a number of years prior, and he wanted to do it. And he did co-teach with me. And we did get to a point where he was so eager to tell his story so people could learn from it. And it did cause more trauma. And that is something that we were prepared for, but certainly is not something that we intended to do. So it's something we all have to work through when we're doing prevention. Excuse me. So the other thing that came out of this that we didn't intend, but I think it's a good um, byproduct is that when we did a pilot for advocates to go through the curriculum, because we have an online curriculum canvas that you can get educated through, is that we had disability agencies want to go through it as well. And we connected them with their local SADV agency, and they partnered and went through it together. And their intent is to present it together, which might help with getting the attendees, would help with getting a self-advocate to co-teach. It would help with bridging those gaps and knowing what your services are, what their services are, and maybe getting more referrals from victims with disabilities. So it was a win-win situation. All right, so let's dive in a little bit to what is included in the curriculum. So as I said, the curriculum is it's a paper copy book, which all of you will receive one per agency, but it is an online format for teaching the curriculum, and then it'll be accessible online to print and reprint as well. So we wanted to make sure as part of that online process that when I had heard years ago, like I said, that advocates felt like they didn't really have a comfort or know enough about individuals with disabilities, especially intellectual and developmental disabilities, that we needed a component that was also introducing those co-teachers, the advocates from the agencies about people with disabilities and about why this was important. So some of the sessions that we had, the first, second, and third trainings that WCASA sponsored, were some of that information, but there's more in-depth information on the online format. And then we include the sessions. So I want to just walk through what the sessions are and why we chose what we did. So when we were thinking about healthy relationships and what we needed to include, I wanted us to think about all relationships, not just intimate relationships or intimate partner relationships. So I, having experience with people with disabilities, wanted to apply the fact that oftentimes individuals with intellectual disabilities are told that their feelings don't matter, or they're discounted, or they're told, well, it's not that bad. So oftentimes people with intellectual disabilities learn to not trust their feelings or learn to not express their feelings, or maybe learn to not even know what they're feeling. So the first session is about feelings, how to talk about them, how to recognize them, what to do with them, and really just kind of walking through that you have permission to feel what you're feeling, and that feeling will help you then navigate relationships, safety, pretty much everything in their life. So that is something that we thought was really important, to start with the relationship with themselves, not just the relationship with others. Then we have a session about my boundaries. So that's more identifying where is my comfort and what are my boundaries within that, and what does that look like for me, and then how do I express that to other people, and then how do I also respect somebody else's boundaries, which then moves us into respect and consent. I think we use the word respect a lot. I think we use the word consent a lot, but we don't always talk about what either one of them mean or what either one of them look like. And especially when you have somebody with an intellectual disability who has been taught to be compliant, as we talked about that in one of the other sessions, they don't always understand what it really is to be respected. And they don't understand what it is for someone to ask permission or get consent to get in their space, to touch their body, because it's under the guidelines of being helpful. So really kind of opening that up and talking about what does that feel like? What does it look like? And how does that um, get communicated? And what can they do if they feel unsafe with those boundaries being crossed, with not being respected, without consent being asked, things of that nature. The fourth session, I felt really strongly about, which is identity. I have worked with many individuals with intellectual disabilities who've not been allowed to identify who it is that they want to be in a dating relationship with, or who it is that they are, and who they're attracted to. They're often told either they're asexual or that they're always heterosexual. And so sometimes I've seen it come out as I had one individual who accused somebody of sexually assaulting him, a peer. And when he and I talked at length about what he had said was abuse, became clear to him and to me that he knew he couldn't say he wanted to spend time with that person. So when somebody saw that other male with him, that he had to call it abuse, so that his mom, who was an older, um, faithful woman who had her own ideas of what love looked like and didn't look like, that she could never know that he was attracted to men. So that, as well as I heard a lot of information during the pandemic of people with intellectual disabilities, talking about how they felt politically, but you could tell that it was repeating what they're hearing in their household. So identity was made to look at all different identities, to have all of us kind of figure out who we are, and then to share with other people what that is and what that looks like, but also to give definitions to that and have an open, free space, safe space to talk about that. Whether or not they wanted to disclose or not, I wanted them to have good information. So I thought that that was really important. Then healthy relationships, more about just what is acquaintance, what is a friend, um, what does equal look like when you're in a relationship, and navigating all of that. And then dating relationships, what does that look like? Is it equal? How does that progress? And then what if you feel unsafe in that relationship? And then finally navigating relationships and a wrap up of the whole curriculum. So those are the 7 sessions. It's meant to go 90 minutes for each session, which would be 40 minutes, a 10-minute break, and then another 40 minutes. But like I said, I understand that that amount of time isn't always something that we can guarantee. So it's also meant to be pulled out for different sections as to what you're allotted to do with that group of individuals or that individual themselves. All right, so I'm gonna just walk through one of the sessions and then many of the handouts just to give you an idea. So each session is set up in this order. This is the My Feelings session. And what I would do when I was doing the first pilot with the self-advocate is we would meet ahead of time and talk through each one of the um, sessions and then all the parts of the session. Initially, the self-advocate was assigned the icebreaker, and we talked about what that was, what that looked like, where they could find information to make one, even helped them set up the first couple, but let them lead that within their comfort level. And talked about other places along the way that they could be involved. So the icebreaker was where we would always start, just something to get people either laughing or thinking or connecting with each other in some way to bring some comfort to the space. Then we set up ground rules from the first class, and we would revisit them at each class. They would be hung in the classroom so that people could be reminded of them And if we needed to, we would go back through them again. But the group would talk about what the important rules were. So things like respect, what does that look like? Um, Waiting your turn to talk, giving other people a chance to talk, not using words that are hurtful, things of that nature. And then I included the what do I need to feel safe in this class? Because I wanted people to think about when they were feeling that some of the content was bringing up some feelings or some discomfort, or they needed some space. What does that look like? So that they could identify it and then they could help me identify it. So if I needed to support them or get somebody else to, that we could do that in a way that everybody felt safe. Here's one of the handouts that we had, and it was talking about feelings. So we ran through some scenarios and things like that around what feelings are and aren't, what they look like, and maybe for each person it looks different. So having that conversation. And then we introduce, and this is in every session, we have three core components that we wanted to be repetitive with because we wanted it to be something that eventually it becomes somewhat habitual. So this tool is called the Stop, Feel, Think, Choose tool. And we introduce it to say, if you're in a situation that is, and we're talking about feelings here, confusing, hard, um, frustrating, makes me happy, makes me angry, makes me nervous, whatever those feelings are, that we should stop because we don't always identify what we're feeling. We just know we have something going on. And then we should feel. So, what is it am I feeling? Am I feeling anxious? Am I feeling happy, nervous, or am I feeling scared, nervous? What does that look like? And then think about your options in that moment and then choose the safest or best option for yourself. And again, we wanted this to kind of become this automatic response, if possible, for individuals to practice. So each time we would do an activity, we would pull this out and say, all right, how would you do this? Stop. What are you feeling? What are you thinking? And what would you choose? Or we would ask about the situation that we're introducing to them. The second of the three core activities was talking about respect, what it is for yourself and what it is for others, how to do it. Because lots of times we talk about what things are, but we don't talk about how actually to do it. So, talking about respect also being reciprocal, two-way street, right? So, if it's not being given, then do I have to continue to respect that individual? Many people with intellectual disabilities are taught to be compliant and not to talk back, not to push back. So sometimes when they're not being respected, they don't even know how to step up and feel empowered to say, I don't like what you're doing, or I don't like how you're making me feel. So that we include in every situation throughout the curriculum. And then consent. What is consent? That's the third core thing that we want to keep into everything. So, what does consent mean? Is it consensual to both people? And it could be anything from, you know, taking a pencil from them. It could be touching somebody, could be being in somebody's personal space, whatever that is. Consent needs to be a practice of giving and getting permission. And if it's not equal, then it's not consensual. So when there was time in the session between, like after we're done doing the activities, we would either have a parking lot for people to put ideas in that we could come back to, or we would just visit what happened that day and ask them if there's something they learned they wanted to share, if there was anything that was confusing, and then maybe if there was something that they were hoping to learn more about. And this was optional when there was time that was allowed. But it often organically just happened. And then a homework. So each session has homework, and it's usually to take the activity or the handout that we used and go practice it at home. So when you come back, whether it's next week or the next day, however your sessions are set up, that it could be a conversation about how did that feel? How did people receive that? What were some things you got stuck on? That's what we would talk about at the next class. But this would be their homework they would take home with them. And then at the end of every class, we would talk about what's next, where, when, the time, all of that kind of thing, and then what the topic was that we were talking about. So these are the following pages are just some of the handouts that we've used through the whole curriculum and developed. Again, if you use them on here, I took off the little tag just to make them easier to read. But if you use them, please make sure that they have the grant on them and online. And when you get them sent to you, you will see that they do have that included. So these are some of the handouts that we use to walk through each session, the boundaries, the personal space, kind of explaining just what that means, what it looks like. Um, Safety rules has always been something that I've worked on when I talk to individuals for the last 30 years. How to say no, how to use your power voice to get away from that person if they're not respecting your no or listening to your no. And then to tell somebody, and I always preface it with saying it's an adult who you trust who knows how to get help. Because it might be an adult peer, but that peer might not know how to get help. So the peer might be someone that can help you go find help, but they won't be the one who necessarily knows how to get help. So finding somebody that can help you, get the help that you needed. And then included is a hand in the handout. Each person gets two contracts, if you want to call them that. And it's for them to identify their safe people in their life and then bring this to their safe people and talk to them about what that means. And when they come to them, what they're expecting. This has been really eye-opening because I've had family members or staff come to me and say that it really did impact that individual hearing that they were that safe person. And it really made them kind of stop whatever they were doing if that person came to them. So I think it's, a good tool for the individual with the disability to identify, but it's also really good for the people in their life to understand that being a safe person that they come to and knowing they're not going to be judged and that they're going to be supported is really important. So it's a good tool that we've used a few times that have made a big impact. Another one of the handouts is the important steps to consent. Again, we talk a lot about consent, but we don't always say, what does that look like? How do you get that? So it's 3 steps: asking permission, and then waiting for the answer, and then respecting the answer. So I use the example often as parents. Sometimes a mom will knock on the door and say, "Can I come in?" And the person doesn't even answer, and they're already in the room. So slowing that down a little bit and teaching the individual that they can go teach their parents or their staff how consent works and that they expect somebody to ask their permission either to come into their space or to touch their body. And sometimes it's not about intimacy, it's about the care that they need and how to touch their body or ask permission to get in their personal space. So I'm not going to walk through every single handout, but the handouts are for each session. So the identity wheel, we use that initially just to figure out how people identify. That's a personal activity you do on your own. And then we also qualify what the equality wheel looks like, that, um, you know, equality means that it's not just sharing my property with you, it's us sharing each other's property or each other's trust or each other's costs or each other's safety when we're together. So, really kind of talking about friendship is not one-sided, it's two-sided, and that it has to go both ways or it's not equal. Defining types of friends or acquaintances, many times individuals with intellectual disabilities will talk about somebody being their best friend. And when I ask them what their last name is, they can't tell me. Or they'll say it's the bus driver. And I'll say, do you know where they live? No. Do you know their last name? No. Do they know where you live? Yes. So that's an unequal relationship. And it's not a friend, it's an acquaintance or a paid provider. So some of those kind of things are important to know the difference, because sometimes those are the people that become the ones who take advantage. I wanted us to discuss deal breakers before somebody's in a relationship. I think honestly, this is good for people with and without disabilities to kind of know where are the lines that they are not willing to let people cross. Because sometimes when you're in the situation, you have a hard time stopping it if you haven't identified it already before you got in the situation. So we have discussions about that, about what makes a healthy relationship, respect, choices, trust. This is something we've had a lot of feedback on and people really appreciate, is that we talk about power. And I know as advocates, we all use the power and control model or the terminology of power and control quite a bit. But we wanted to break that down a little bit because all power is not bad. So there's power with people. That means together we can do something, we can accomplish something. There's power over people, which that's hurtful, or some of the power that we talk about, power and control. And then there's power inside. It's the power that we put inside of us to empower us to stand up for ourselves, to stand up for our friends, to feel confident about what we need and what we want and what we don't want, and not to apologize for us using our voice. And then there's a power voice. So we practice. It's really somewhat I don't know the word. It, it's somewhat alarming to talk to somebody with an intellectual disability who's been raised in the compliance arena, to tell them that they have a power voice and they can say no, and practicing no, because 9 times out of 10, what they'll say to me is, please don't touch me, with this real small voice. And I challenge them to say, if someone's not respecting your boundaries, if somebody's not listening to the boundaries you're putting up, then you don't have to be polite. You don't have to say please or thank you. And you can use a big voice, a power voice. So that's the voice that we practice. But if you've been taught all your life that when you make noise or when you stand up for yourself, that people either punish you or don't listen to you or minimize your feelings, you don't know how to find that power voice. So helping them find their power voice, I think, is really, for lack of a better word, powerful. We talk about power and control with the individuals and help them identify what that looks like. And I'm showing you the handouts, but there's activities that are written out specifically for the instructors as to what supplies do you need, um, what conversations you can have. There's starters around conversations. Doesn't mean you have to use that, but it's there as a tool to use, at least in the beginning when you're starting to get comfortable with it. There's knowing your rights around power and control and how to tell somebody or get help. And then I believe strongly in the that sexuality is something that people with disabilities have the right to want and have, as long as they're informed and it's consensual. So, one of the reasons we have consent as part of this curriculum is teaching what that looks like. And I found this sexual self-advocacy Bill of Rights handout that was made from a self-advocate group in another state and got permission to use it. On the handout that you'll have access to, it has all of that identified. I just cut it off for space on this PowerPoint right now. But when looking at that, I thought it was really well done, and self-advocates were the ones who put it together. And then as I thought about it more, I thought, there's rights around sexual self-advocacy and being a sexual person, but there's also responsibilities that come with being a sexual person. So I wrote the second half of this, which is the responsibilities around asking questions, getting accurate information, around respecting your partner, around communicating what do you want, what do they want, and getting consent, about listening to stop or no at any point and respecting that, about taking the time to know the person and trust them before you engage in sexual activity, and then about getting information around healthy sexuality for their body, around disease or pregnancy. So I think that's a really good tool, and self-advocates have really appreciated having access to something like that. And then I didn't want to ignore the fact that sometimes there are breakups, and breakups can be painful and hurtful. So talking about what does that look like, and then how do you take care of yourself with that? So with that, it all comes down to the nothing about us without us, and wanting to make sure that self-advocates were part of making this curriculum, but are also part of teaching this curriculum, because it really is about individuals with disabilities getting empowered to have a full life and full access to the same things that you and I want in our life. We all want somebody to care about us. We all want somebody to um, want to be around us, and we have a more private or intimate, and I don't mean sexual always, but like an intimate relationship, a best friend relationship, possibly a sexual relationship, but we all need to feel needed. And if I talk to any self-advocates around, well, honestly, around the country, I've talked to many self-advocates, and almost all of them, the biggest thing is that they're lonely, that they want to be with other people, they want to have intimate relationships, and they don't have access to that. If this curriculum can empower them to build relationships, maybe even connections right in your classroom that you have or the classes that you have, that is great. But also then being empowered about what does it mean to be in a healthy relationship, I think that's really important too. So I'm going to pause for a second to see if there are any questions. Angie, anything?
There hasn't been anything typed in the chat yet.
Okay. I know I went through that very quickly. Um, what I want to tell you is that there will be an online training that everybody will have access to, and that has to be approved by OVW for our grant. Our grant ends at the end of September. So sometime between now and October, it will go live. Once it goes live, you will know about it, and then you can feel free to access it and use it within your agencies or your communities. And also feel free to reach out for any sort of resources or guidance along the way. That was my hope, is that if we needed to have drop-in conversations with people who are doing the training, or online questions and answers, whatever that might look like, that we have a living breathing document on the curriculum online, or I can be emailed individually. So that is the hope. So one of the last things that I have done for this curriculum as I'm getting ready to kind of send it all for approval is I was having a conversation with somebody who I know I just saw is online watching with Stephanie. And Stephanie is a self-advocate as well as a healthy relationships educator. And she went through the pilot. I'm talking about you, Stephanie. I hope you're okay with that. Um, but she and I, after she went through the pilot, I said, can we have a conversation? And we had this really robust, great conversation. And it gave me the idea to interview some self-advocates around healthy relationships, around what does society look at, judge around people with disabilities having relationships. What do they wish they would have gotten as good or helpful information when they were younger? Um, what do they wish they would have gotten now in retrospect after they've been abused in some way? So I interviewed four self-advocates. Stephanie was one of them. And then one of the self-advocates I interviewed was Chad. So we're going to listen to what Chad had to say in a minute. I wanted to get self-advocates who A, were comfortable with speaking their truth, B, who were safe and empowered to do so, and who felt safe and empowered with me to do so. And most of all, and this is the part I haven't spoken to yet, but in the Nothing About Us Without Us, I feel very strongly, and I would advocate that each of you um, use this as part of your planning when you do this curriculum, is if a self-advocate works with you, their time should be respected and should be paid for as well. So when asking Stephanie and the other three self-advocates to work with me on making a video, I found a way to pay them. Because if we want to show that we're respecting somebody with a disability, to know what they and other people in their circle want, then we have to respect their knowledge and we have to acknowledge that they bring a specialty to the table that we do not have. And using them as volunteers is not best practice, and it can be insulting. So understanding that that is important when you're looking at doing this training. And if you need ideas about possible funding sources or ideas about getting into the disability community, I'd be happy to have those conversations with you either in a group or individually. So, but I just really want to stress that. So Stephanie and the other three individuals, the four self-advocates, they're all from People First Wisconsin, and they all do a lot of self-advocacy, as you'll hear from Chad, in their life beyond what they helped me with this. But again, Nothing About Us Without Us to me means that we're listening to them and not just doing what we think they need, but we're actually taking into account what they think is important. So I see that there's a couple things in chat. So I'll stop for that for a second and then we'll go into the video.
There is a comment from Steph.
That's what I
Um,
figured.
she was saying how to please bring us in to teach with you and paying people competitively and fairly for their knowledge, expertise, experience, and time.
Thanks, Steph. Well said. All right. Well, then I am going to share a video with you. The video should have captioning on it. If it doesn't, I'm going to quickly turn it on, but I believe we did caption it. So we should be okay with that, but I just wanted to let you know if it's not right away, I will pop it on. And it's about 30 minutes long, which I know feels like a long time, but Chad has some really important things to share. And I'm just the question asker along the way. I've had some people say that they appreciate hearing how I ask questions because they don't always feel comfortable asking questions. So if you need to glean something from that as well, and that's helpful, great. And if not, Chad is the expert in this video. And then we'll come out the other end and have some time for a few questions. Chad, thank you for doing this with me today. And could you introduce yourself and tell us a little bit about yourself and your disability?
Um, yeah, my name is Chad Sobiek. I live in Madison. I'm currently, um, my people first background is that I am the uh, president for the Madison chapter. I also currently am an intern through the ARC Wisconsin. I'm on the youth leadership board of directors. I do a lot of different things. I've taken partners in policy making. I've participated in a lot of different trainings with the board for people with developmental disabilities. I participate in self-determination conference. I go to the Capitol and speak to my legislators. So I do a variety of different things. And my disability is cerebral palsy, meaning a lot of my disability is physical, and I am wheelchair bound and I need assistance with day-to-day tasks from caregivers.
Okay, thank you. And are there other disabilities that you have besides CP or is CP?
I have some cognitive
Okay.
function stuff.
Okay, thank you. Thank you for letting us know. So as you know, this curriculum that we wrote is about healthy and safe relationships. And we are interviewing a few people around Wisconsin who we consider to be self-advocates. And that's people with disabilities who are empowered to stand up for themselves and other people in our communities. And we are asking them just about how they learned about healthy relationships and what's important. So I'm going to ask you a few questions if that's okay.
Okay.
Okay, good. So can you tell me, growing up, think back to when you were younger, how did you learn about relationships?
I would mostly say a lot of my knowledge and training around relationships have had come through my time in the school district. I didn't really have a family that taught me a lot of skills, so I would say a lot of that came out of school. I was in speech to work on my speech issues and just did a variety of different opportunities to try and understand the vulnerability that I have as a person with a disability and knowing when to disengage from an unhealthy situation and knowing when to speak up for myself.
Good, thank you. So do you think that you got enough information about healthy relationships in school? Because I remember school for me and for my children who don't have disabilities, that they didn't talk a lot about relationships in school.
No.
It was just kind of a little bit here and there.
Yeah, it's not a ton. Fortunately, I was a really pretty smart individual in school, so I kind of figured it out sort of on my own through like connections and friends I had. I made sure my friends were safe and that I felt comfortable and that I wasn't taken advantage of because I always knew, even at a young age, I have a disability, it's physical. My ability to defend myself isn't quite as great as someone else. So I have to be careful who I hang out with. So I was always mindful of like the people I'm around, making sure the people that are around me truly care about me and aren't in it to take advantage of me. Um, and I just kind of figured it out as I went. But as I as I got older, there were a lot more training courses and stuff around healthy relationships. I know People First has done stuff. I've participated in some of those trainings to just remind myself, like when I should step back from something, when what things are okay, consent, all those type of things.
Okay, thank you. Do you think that as a student with a disability that you got less than your peers without disabilities, less information about healthy relationships?
Yeah, and I also feel like I had to learn how to deal with people that were sometimes not always the nicest to me because I was in a wheelchair. Like I do drool sometimes. I look different than other people. And so I feel like as a person with a disability, you're always a target to get picked on and bullied in school. And unfortunately, that did happen, but I did also have a lot of really good friends growing up that kind of had my back and would stand up for me. But yeah, I definitely feel like I got less. I definitely feel like in general, people with disabilities in school don't get the same opportunities at education for various reasons.
Yeah, I think you're right. Um, and I don't know if that's out of the assumption that you won't understand or that they don't know how to teach people with disabilities or that they just don't want to take the time to do it. I'm not sure the why, but I agree. A lot of people are telling me that they're not getting as much or any information around healthy relationships, um, especially when they're thinking about dating and stuff like that.
I think I know one of the whys. And the reason I can say I think I know one of the whys is because I learn differently from others. Like, I can't take a lot of information in chunks. I need to take bits of information to, because I have a comprehension disability. So I need little bits of information at once. If I get too much, it's overwhelming, and I'm like, oh my God, I need somebody to help me take notes because I can't possibly keep track of all the things like that. I think the challenge for schools is accommodating the different ways in which people with disabilities learn, which is unfortunate.
Yeah.
And also not funding special education.
Right,
but that's
right.
a whole nother bag.
Yeah. But along with the not having the ability to, kind of accommodate people with different learning abilities, it's the funding that would help them be able to do that more. So yeah,
Absolutely.
Agreed. So so I'm gonna ask you a personal question. You don't have to answer it, but I'm assuming, and I should never assume, but as somebody with a physical disability, CP, you had said, do you have a caregiver who helps you with some daily grooming type activities?
Yep. Um, I actually have my caregiver is here right now, and she's wonderful.
I saw her in the background there. I assumed so.
But the the one thing is not all the caregivers are always wonderful, and sometimes you get taken advantage of, and we can get into that. But yes, to answer your question, yes.
Yeah, well, that was kind of what I was going for, Chad, was to kind of take a couple minutes just to talk about how really your personal space isn't your personal space when you need a
No.
caregiver. And
No.
oftentimes if you refuse that care because you're not liking the person, you're feeling uncomfortable, you don't want it to happen right now, then you're left with no care sometimes, and that's
Yeah.
not a good choice. So how do you deal with that, or how do you figure that out?
It takes a crazy amount of patience. And there have been times when I felt that exact same way. And because agencies are so desperate and they don't have people, unfortunately, the quality of care goes with it. Excuse me. The quality of care goes with it. And so I feel like we're forced to deal with a lot of situations that caregiving companies, depending on the issue, don't really think it's a big deal because they have nobody to easily replace them with. And so there are situations where I feel like we're kind of let things go when we shouldn't. Nothing too crazy, but sometimes if they're late, we might let something go or something like that because we know that we may not get care if we complain too much. So it leaves you in a very vulnerable spot.
Yeah, I definitely know of many friends of mine and colleagues that have refused care because of the way somebody treated them or made them feel, and then really had some medical issues around not getting the care that
Yeah.
they needed by getting infections or
Yeah.
whatever that was. Um, so that brings me back to the healthy relationships curriculum and learning about boundaries. Because even if we teach about boundaries, there's this little kind of like, yeah, but
Yes. Yes, there is.
what does that mean,
You are
Chad?
exactly right. You are taking the words right out of my mouth. You know exactly what you're talking about. Yes, that is very much the case. It's yeah, but I know if I don't take this today, it means no care. And if it means no care, this is what happens. So do you deal with the situation that you don't want to be in? I'm an advocate, so I call, but the agency will sometimes really fight because they're like, oh, can you stick it out a little longer because we don't have anybody right now. But we can get somebody that, but if it's really bad, like if something personal happened, I'm shutting that down. Like, I'll kick them out. But
Yeah,
that's never happened, thankfully. But
yeah,
I have been taking advantage of because of my kindness. They get comfortable and they try to get away with things. Like maybe they're slowly doing less work, and I'm starting to notice, and then I have to point it out, and then they get defensive, and then I have to call the agents. So I think caregivers sometimes not the lady here, but caregivers sometimes take advantage of my kindness.
yeah. I think that that's a pretty accurate statement, and I'm grateful to hear that you haven't had anything go too far south
No,
before you've gotten some assistance. But doing the work that I've done for many years, I know that many people have had it go too far south. And when they complain or they report, then there's this concern of, will that person get replaced or will I have to live without?
and I think honestly, caregivers, caregiving companies should do like a basic course around healthy relationships around clients. I really do believe that should be a thing.
Yeah, one of the things that I teach in this curriculum, but I talk about a lot when I do trainings, is we talk about power and control and how that looks in the world. And especially, and the one thing I talk a lot to people who don't know about people with disabilities, how much power and control comes into play for people with disabilities. Like if a caregiver says they're not going to do something, or you have to do something or else they won't let you go somewhere, take you somewhere, give you your medication, give you a shower, whatever that is, like that's power over you. And sometimes it isn't even a choice, it's abusive.
And I always say to people, I'm a great advocate, but it's so hard to be an advocate yourself for yourself in a caregiving field where sometimes it shows a little, I don't want to say it shows weakness because we're good advocates, but you do end up in an awkward situation of like, how do I respond to this? And so you kind of just figure out as you go, and you maybe get through the day, and then you have a conversation with the agency or whatever that looks like. But I kind of figure out as I go, and I might report and say, hey, this situation happened and I'm not really comfortable. And I talk to them and they're still not understanding. Could you please talk to them?
Yeah, and I'm super glad that you're a great self-advocate, but I think you and I both know a lot of people who would not talk about it or not tell somebody that somebody's doing something wrong. And
Right.
I think that and to help me if I'm wrong, but I think that that's out of fear.
Yeah. It's it's absolutely out of fear because that person is there to help make sure you can get ready for the day and conquer the day. And if that person leaves because something is happening, you might not be able to go do what you have planned today. Or it might or you might not get a meal and then you might end up having to go order something, which is getting more expensive. That's happened to me. Like I've had caregivers not show up or had to ask them to leave because it was, the situation called for it. And that meant I had to go without, but you kind of weigh and choose your options and figure out, like, depending on the situation, how do I deal with this? And it really is sad. The quality of care is just the quality of care is just not there because we're not supporting our caregivers and people with disabilities, especially when caregivers see that, they see the vulnerability and they take advantage of it. And it's
Yeah. And I think a lot of caregivers are really good caregivers.
Yeah.
I think a lot of caregivers are doing it for all the right reasons and not getting enough money to do it.
Yeah.
But I think sometimes what?
I've had some excellent caregivers who are like, I love this job. I love working with you, but I just can't afford to do it, especially in Madison.
Yeah, yeah.
That's the hard nature of
think
it.
that's everywhere, but I also think that the good ones work so hard and the bad ones don't work hard at all. And then the good ones burn out eventually, you know? I see you looking at your caregiver. She's agreeing to all the stuff we're saying here, right?
Yes.
Yeah. Yeah. So let's talk just a little bit more about healthy relationships. So what about dating relationships and what about like you're an adult? Yes. I know you are, but I'm asking you to confirm that you're an adult. So yeah. I'm assuming someday, maybe now, I don't know enough about your personal life, that you want a relationship with a partner that you can share life with, right? Yeah. Yep. So what does that look like for you and how do you navigate that?
I have dated in the past, and I think the challenge has become, well, it's a lot of like very personal stuff of like, how do you perform? Like how are we gonna go and hang out when you can't get in my car? So they have to be very accommodating and very understanding of the situation. And that is very hard to find. Not impossible, but
Yeah.
it is very hard to find.
Do you find that you're usually dating somebody else with their own disability?
I dated people mostly with disabilities, but a few with them.
And possibly, I'm assuming because oftentimes that's the circle that you socialize in, like self-determination conference. I know about
Yeah,
the conference, one of my favorite all-time things. But like there's
yes.
a lot of people there that you know and you don't know yet. And you meet a lot of good people there. So
And I think it's the societal barriers of like a person with a disability doesn't always, or a person without a disability doesn't always give you the light of day to even have a conversation or get to know you. They look at you and they see a wheelchair, they see a device, they don't see a human being.
yeah, they don't look past your disability and see that you're actually, a cool person to hang out with, right?
Yeah, and that's not everyone, but
Yeah,
unfortunately, that is a thing that happens.
right, right. So, what do you think is important for people with disabilities to learn about healthy relationships? In this curriculum, we're doing this and we're using this for the teachers that are going to teach it. What kind of things do you think are most important for them to get through to the people with disabilities that are taking these classes?
To be very careful of the people that you are spending your time around, making sure you know the triggers of when someone is potentially taking advantage or looking to manipulate you in some way, because it does happen, unfortunately. You should try and know what those triggers are for you and know what to do to stop them, whether it's saying something yourself, calling someone for help, getting some. It's okay to ask for support too. It is okay to ask for support, because sometimes our voices aren't strong enough, no matter how good advocates we are.
Yeah,
Because they're like, oh, this guy in the wheelchair, you can't be serious.
yeah,
And so I think for people, like just knowing those triggers, knowing when to step back, knowing when to say, okay, this is unhealthy, but also know what works for them. Like, what relationships are you in now that you really do value, that you trust the person and you've been friends with them for 10 years and they're not going to do any harm to you. I have a really good childhood friend who I grew up with, where I could say that very same thing. Like, I trust him because we grew up together in the same neighborhood and all those kinds of things. So it's knowing yourself, it's knowing what you're okay with, it's knowing what you're not okay with.
yeah, yeah. No,
It's
those are
knowing
good.
when to ask for help, who, maybe make a list of like, who do you go to? Is it a caseworker? Is it, my mom or dad? Whoever supports you that you feel comfortable sharing that very personal information with, and say, this person is doing this to me. And it's okay. Like, maybe you could ask them and say like, is, you know, does this sound like something I shouldn't be associating? Because sometimes we don't realize what we're doing is very not actually unhealthy.
Yeah, yeah. Well, three of the things that are in the curriculum you talked about. So first one is that we have to recognize our own feelings and what they are and what they mean. And if I'm feeling afraid, kind of recognize that and figure out why, or if I'm feeling uncertain. And I think sometimes people with disabilities are told their feelings don't count or they're minimized, like, oh, it's not that bad. Those kind of things happen. Another thing that we have in the curriculum is identifying who your safe person is so that you can go to them when you're feeling that way and you know that they're going to listen to you. So there's even like a little, kind of like a little contract that you give to that person to say, when I come to you, here's what I need from you. I need you to listen. I need you to help me figure out resources. I need you to like support me, whatever that looks
Yeah.
like. And then
Yeah.
the third one that you talked about is safety planning. Like, if before I go into a situation, having a plan to say, if I feel this way, this is what I can do. If something
Yeah.
like this happens to me, here's where I can go, or who I can talk to, or how do
Yeah.
I get away, those kinds of things.
Yeah.
So I think you completely reinforced what we have in the curriculum, along with the fun stuff of dating, right? I mean, dating is not all scary and
No.
bad people, but if
No.
you don't know when someone's in it for the wrong reasons or taking
Yeah.
advantage of you, then you might never get to the point where you're meeting that healthy relationship and actually deserve to be happy and being happy with it, right?
The intimacy part of it is very personal, and it has to be consensual. So if they're doing something or something's being done where you're like, oh, I'm not ready for this, or this is really uncomfortable. Unfortunately, there are some people that would say, oh, I love her or I love him, and it's okay, I'll just let it happen. And that's something that we have to reinforce. That's not okay, because one thing is, if they see they can get away with it, it doesn't just happen once, unfortunately.
Yeah. Yeah, definitely. And that's another thing. I mean, Chad, you could have written this curriculum with me. So a big part is consent, and not just what it means, but how do you give it and how do you get it?
Yeah.
What does that look like? And I think sometimes we say, oh, make sure you get consent, but we don't talk about how do you do that? What does
Yeah.
that look like? So yeah, I think you're right. And sometimes we have to help people understand that just because I want a boyfriend or a girlfriend doesn't mean I should put up with bad behavior.
No.
And or put up with abuse, I would call it, right?
And unfortunately, this isn't just people with disabilities. This happens to average everyday people.
Yeah.
And so, especially when you're talking about a person with a disability, that is really important, because people with disabilities have a little bit more of a difficult time finding those relationships. So sometimes that I had a friend um who had various medical issues. He had a heart transplant and he had various medical issues. And he stayed in a bad relationship because he didn't think he could get anybody better. And I've heard that a lot with people that have disabilities and health issues. They stay in something because they want to have somebody. And they're like, well, who else will love me with all of this baggage?
Yeah, that's so true, Chad. I worked with somebody who said to me, yeah, I know what he's doing is abusive, but at least I have a boyfriend. If you can find me one that doesn't abuse me, then I'll switch, but otherwise, at least I have one.
I would honestly be forever alone other than doing that. You know why? Because that's not true.
But see, I think you know that, and that's why this curriculum is so important, is that we have to start talking about what is and isn't love, what is and isn't a healthy relationship. And that's exactly why we're doing this. That's exactly why it's needed, right?
Yeah.
Yeah.
Right.
Yeah. Well, Chad, is there anything else that we didn't talk about that you think the people going through this training who are going to talk to and spend time with people with disabilities need to know?
I would say, like, consent consent to me starts with a conversation. If you want something or your partner wants something from you, you should always ask. Even if it's just a gesture of like touching or holding their hand or doing something. You should know when that's okay. You should know what spaces that's okay in. Like if you're in public, holding hands and stuff is okay, but you might not want to be reaching for their private area or something like that. So just knowing when, just reinforcing the spaces of like what kind of contact is okay in what spaces, and just making sure you ask if you want consent for something. Because if they don't say yes, if they're hesitant about it, that's not yes. They have to say yes. They have to feel comfortable saying yes. If they say anything else but confidently yes, to me it's a no.
Wow, thank you, Chad. That's exactly what I would have said. You just took it out of my head and threw it out there. So I super appreciate all of your information. And I think all the people who are watching this are really going to take a lot with them. So I appreciate you. Thank you.
Thank you so much, Pam. Thank you for all the work you do and keep doing it. It was good to see you again, albeit dusty. So I hope to see you there.
Thanks. Okay, so I'm gonna quickly just tell you that the slides at the end here talk a little bit more about the Victim Advocacy Program and what we can do to co-advocate with any local advocates who are working with individuals with disabilities who've experienced sexual assault, domestic abuse, caregiver abuse, and other things of that nature, and how to call us. And then I just want to open it up for any feedback or questions because we have a few minutes. So I'm going to stop sharing. So how did you feel about Chad's conversation and how that went?
Hey Pam, this is Steph.
Hi, Steph.
Hi. Um, I admit I might be a little bit biased because he's we roll in the same circle, shall I say. Um, but Chad, go Chad. I mean, he's um exceptional, exceptional person. Um, and um unbelievably like just what I really appreciate is you got to the core, the two of you together got to the core of um, his expertise and really gave him the floor to bring it forward. Um, and I think it sheds a different light on something people don't always know is there in our community because there's a lot of us out there that do a lot of things. We wear a lot of hats and we do a lot of work. Um, so that's just wonderful to see, and it's wonderful to see him be his brilliant, badass self, if I may. um, and I mean, even in what he said, it brought up things for me that I've been thinking about, like the um, being in a relationship when you have a disability and health issues, and seeing that as well, anybody else is going to see me as a burden. Um, and so I'm going to stick with what I have. Like, um, I've felt some of that in my own life, and like, it made me think of a moment when I was dating the man who's now my husband, Ben. Um, and we were getting ready for a trip, and I just all of a sudden got overwhelmed by disability stuff. And I paused and I said, I'm so sorry. It takes so much work and so much planning and so many things, so much equipment and so many things for us to just go on a vacation or go on a trip and enjoy something. And there was this pause, and he said, I want you to know this straight from me, and I want you to remember this. I would do this a million times over if it meant spending time with you. If this is what you need so we can do that, we're doing that. That's the kind of person I want to see everybody in our community with. And I know they're hard to find there, and it just looks different. Um, but I just wanted to speak to that because he did a like absolutely brilliant job um, encapsulating that in what you talked about. And now I'm going to get off the mic so other people can say stuff.
Thanks, Steph. I appreciate that. I mean, first of all, I want you all to know that all of these interviews I did and recorded, none of them had any planted questions at all. This was just a conversation. So the fact that Chad went down the lane that he did speaks truth to what we're doing here, which is giving you tools to help individuals with disabilities navigate those relationship things that we all encounter, but then the other layers that people with disabilities encounter even more. And not, I mean, we as a society, we kind of glamorize romance and we glamorize love and all of that kind of stuff, but we need to be start talking the truth. We need to talk about what it is and what it isn't and how not to settle. And Steph's example of what her husband does, boy, all people, regardless of disability, would like to have somebody who says, listen, whatever barriers you or I have, we're in it together and we're going to figure it out. And that's just part of who we are, not that extra burden that I carry with me. And I think that that's truly what we're all looking for. So thank you, Steph. I applaud that. Anybody else want to give any input? We have a couple more minutes.
I'll say something quick, Pam.
Thanks.
I'm Rachel. I'm a sexual assault advocate. One thing that I actually thought was interesting that I didn't think about, a point that Chad made at the very end. Obviously there's a lot of things that some people with disabilities don't recognize, and one of them being, like when physical touch is appropriate in what settings. That I thought was really interesting because that was something I didn't really think about. So I thought that was a good point that he made at the end.
Thanks, Rachel. Yeah, I mean, I think a lot of conversations I have are around public behavior, public parts of your body, and private parts of your body, and knowing kind of the difference between that. And sometimes we assume that everybody understands the definitions of those words, but we can't assume anything. But we also can't, what's the word I want to say? We can't infantilize the individuals that we're working with. We can't treat them as children who don't know anything. Chad is an adult male. Stephanie is an adult female. They have life experience that they bring to the table. And if we don't include that into who they are, and we assume that people with disabilities in general, we need to like talk to them like we're talking to our 3-year-old or our 10-year-old, then we are getting it wrong every second of the time that we're doing it. I would encourage, when you do start working with self-advocates or start talking to people with disabilities about interest with this, set aside some time and have those conversations with them. I mean, this curriculum certainly is a guideline because it's tools that people don't have access to every day that they want access to. But by no means is this like you have to do A, B, C, and D all in order. If the people that are in your class or that you're talking to need something more specific to them, that you have to add a little more detail, then please do that. But take it from them and what they need, and don't assume that you know where they're starting and where they want to end. None of us know what the other person has experienced. And if statistics are that people with intellectual disabilities experience sexual assault 7 times greater than those without disabilities. The only assumption we can make is that people have not treated them well and have probably taken advantage of their kindness or their disability in some way to hurt them. And we have to be able to insert good information in the terms that they need, in the way that they need to hear it, and in a space that they feel safe to hear it and ask it. So I really appreciate everybody who attended any of the 4, all of the 4 especially. I want to applaud you. And I want to thank WCASA for inviting us to do this. I think it was really important and valuable. I mean, I don't know if you could see my face while I'm watching Chad, but I was like smiling and interacting again with him because I so appreciate him and the other self-advocates, including Steph, who shared wisdom. I learn every time I talk to self-advocates. And I hope that you will find that same experience and then just kind of soak it in. We are not the experts of their lives. They are the experts of their lives. All victims we work with are the experts of their lives. And we can't assume that we know what they need or what their experiences are. We need to ask. And that's no different for people with disabilities. So thank you for being willing to do this. I believe we decided that